Hello everyone, let's get started. In this video we will be talking about vaccination. We define a vaccine as being a substance that's used to stimulate the production of antibodies and provide immunity against a virus. Now, it is true that there are vaccines against other types of pathogens, including bacteria, and we still call them vaccines. But technically speaking, the term vaccine refers to a product that is intended to provide immunity against a virus. Now, why do we vaccinate? We can think of three very specific reasons why we bother vaccinating. The first one is obvious. We want to be able to promote immunity in an individual to protect them from disease. We also, though, want to be able to promote herd immunity. And remember, herd immunity is defined as a level of immunity in a population, generally 90 to 95%, that will both protect people who can't be vaccinated and will reduce the incidence of disease in the community. So promoting herd immunity is an important goal of vaccination. The third reason that we vaccinate you may not be familiar with, and that's to prevent certain types of cancers. We're going to talk about all three. Vaccines have actually been in use since the end of the 18th century. A name that you should know is Edward Jenner's, and Edward Jenner is credited with developing the first smallpox vaccine, which was critical for helping control the spread of the disease smallpox. So again, the first and arguably most important reason that we vaccinate a person is to protect that person from developing that particular disease. But we're also trying to promote herd immunity in the population or the community of people in order to prevent disease. We need a 90 to 95% coverage in the community to achieve herd immunity against our most infectious diseases. The reason we try for herd immunity is because we want to protect the individual. We want to protect our most vulnerable populations, the people who cannot be vaccinated, and that includes very young infants, the elderly, people who are chronically ill, and people who might be allergic to components that are inside the vaccine. By achieving 90 to 95% immunity against an infectious disease in a community of people, we can protect those very vulnerable members of the population. And finally, we just want to reduce the prevalence of that particular disease. And when we achieve herd immunity, we will see that disease reduce tremendously in its prevalence. Now, third on the list of why we vaccinate is the prevention of cancer. Certain types of cancer are now known to be the result of infection with particular viruses. For example, human papillomavirus has been shown to cause about 90% of all of the cases of cervical cancer. Now, you might ask yourself how a virus can cause cancer. And the answer is that certain viruses, once they gain entry into the body, persist in the body over long periods of time. The HPV virus, once it enters the cells inside the woman's cervix, can stay there for long periods of time and stimulate a chronic, ongoing inflammatory response. And that's what's believed to lead to cancer in some of these cases. Another virus that we have identified that can lead to the development of cancer is the hepatitis B virus. And this virus infects liver cells and so can lead in some people to the development of liver cancer. We now have vaccines against both HPV and hepatitis B. It's actually possible now to use certain vaccines to treat cancer as well as prevent it. The way this is done is by harvesting certain cells from the tumor in the patient and then allowing the person's own immune cells in culture to react to the cancer, to develop antibodies against the cancer. Those antibodies are then injected back into the person's body, and the antibodies are allowed to attack and kill the tumor. Now, this is a very experimental type of cancer treatment, and so far it's only commercially available for one type of cancer, and that's advanced prostate cancer. But there is a product on the market. It's called Provenge. And again, as you can see over on the right-hand side of the slide, it's a treatment that is patient-specific. Tumor cells are collected from the person's prostate gland. They are grown up in culture with the person's own white blood cells. And those white blood cells then produce antibodies against that specific cancer. Those antibodies are then injected back into the body, and they are allowed to attack the tumor. Provenge has had some very positive results. So we need to ask ourselves, who are we vaccinating? And a lot of people just assume that vaccinations are for children. And it is true that we spend a lot of time and effort vaccinating infants and children in order to protect them sometimes throughout their life. But we also vaccinate teenagers and young adults. We vaccinate the elderly. We vaccinate pregnant women to protect them and their developing fetus. There are groups of what we call at-risk people that we'll talk about. And we also vaccinate people who are traveling to parts of the world that are known to experience diseases that we don't have in our country. So what exactly are vaccines made out of? I have a list here that is the general recipe for making a vaccine. First, of course, you need the causative agent. You need the pathogen to be in the vaccine. Now, when I say we put the causative agent in, we're not putting in the infectious agent in its entirety. We're either killing the agent or we are attenuating the agent. Now, these terms get a little confusing when we talk about viruses, since we don't think of viruses as even being alive. So the word killed, when we're referring to a virus, is essentially taken apart. We take the viral particles and we disassemble them in the laboratory to be used in the vaccine. The pieces and parts of the virus are still there, and the immune system is still able to react to them. But an attenuated vaccine actually stimulates a better, longer-lasting immune response than a killed vaccine does. Attenuation means weakening the infectious agent. And again, it's hard to use a term like that when you talk about a virus, but essentially when we attenuate a virus, we're going to alter it in the laboratory so that it does not have its original structure and its original infectivity. It's not capable of causing disease, but it is still intact enough that you get the best possible immune response to it when you inject it into the body. Both killed and attenuated viral agents are not capable of causing disease in the person they are injected into. They can stimulate the immune system, but they cannot cause the disease that the whole normal, naturally occurring virus can. So the causative agent has to be included in the vaccine, obviously. It is possible to put the causative agent into a vaccine and only include one piece of that agent. These vaccines are actually growing in popularity. We have developed some vaccines, for example, that only include the genetic material of the virus, or only include one of the proteins that might be present in the virus. The idea is the same though. You have to put in enough of the causative agent so that you will stimulate the immune system. That again is the goal of the vaccine. But you want to make sure that what you're putting into the vaccine cannot cause disease. Another very important ingredient in a vaccine is preservative. Now, preservatives have come under fire in recent years as people have questioned the safety of vaccines. And that's because there's been some concern that some of the preservatives that we've used in the past may have some risk associated with them. You still have to put a preservative into a vaccine, though, because you have to allow for the vaccine to last long enough to make it a practical drug, a practical product to use in medicine. It needs to have a relatively good shelf life. If we put vaccine into a bottle and it only lasts for a couple of days, it's not even going to make it to the doctor's office, let alone last long enough to be injected into people. So the preservatives that go into vaccines are there so that the product has a longer shelf life. Next on the list is the term diluent, and you'll see I have a plus and a negative next to that word. Not all vaccines have diluent associated with them. The last word on the list also has a plus or minus next to it. That's adjuvant, and not all vaccines have adjuvant in them. So not all vaccines have diluent or adjuvant in them, but they're common enough that I wanted to mention them today. All a diluent is a diluting agent, and typically it's sterile saline. Because some vaccines are produced commercially to be in a powdered form, a dried out form, you have to dilute them with this diluting agent, this diluent, before you can inject them. So a lot of commercial vaccines, when you unpackage them, they come in pairs of vials, like you can see on the right-hand side of this slide. There's powdered vaccine in this vial, and there's sterile diluent in this vial. So you would simply pull the diluent out of this vial with a sterile syringe, place it into this vial, and rehydrate the vaccine. Then you could draw the vaccine out of this vial and inject it into the patient. Some vaccines are not in a dried or powdered form, so you don't have to add any diluent. They come in a liquid form. Adjuvants can really vary. The purpose of the adjuvant in a vaccine is to help increase the stimulation of the immune system. For some vaccines, the vaccine itself is very good at stimulating an immune response. But in other vaccines, we can't get as high a level of antibody production with the vaccine itself. So we add a chemical, an adjuvant, that is particularly irritating, if you will, to the immune system. And again, these products can vary. They vary from vaccine to vaccine, but that's all an adjuvant is. It's a chemical that we add into the vaccine whose job it is to stimulate the immune system just that little bit more, so we'll get a better response to the vaccine. Now, how exactly do vaccines work? Vaccines can be deposited inside of tissue, and that's how many of our vaccines are delivered, through injection under the skin or into the muscle. And other vaccines can be delivered on top of tissue. And you've probably seen some vaccines that get sprayed up people's nose and land on the soft mucosal tissue inside the nose and the back of the throat. So we're going to deposit vaccine where we think we're going to get the best immune response to that particular infectious agent. Now, the antigen inside of a vaccine is the part of the vaccine that is actually stimulating the immune response. So typically these are proteins, and they are going to act by stimulating different parts of the immune response. Once antigens are deposited in or on tissue, the first immune response comes through what's called the innate immune system. The innate immune system are the types of immune cells that first encounter this foreign material. These immune cells are going to come in contact with the antigen within minutes to hours of the depositing of the vaccine. Your innate immune system is also your non-specific immune system. In other words, this is the part of your immune system that sees foreign material, like a vaccine, and just destroys it. You also have what's known as an adaptive immune system, and this is the part of the immune system that produces antibodies. Cells in the innate immune system will present the destroyed material to the adaptive immune system, and the antigens inside of that vaccine or other material will stimulate the production of antibodies. Now, antibodies are very specific. Antibodies are made against each individual antigen. The other thing that the adaptive immune system does is it remembers. In other words, once antibodies are produced, there are cells on the adaptive side that will remember that antigen for the next time the person gets exposed to it. So when you get vaccinated against certain diseases, the next time your body gets exposed to that particular infectious agent, the memory of that agent will be reactivated, and your body will produce antibodies much quicker than the first time it encountered that agent. So, vaccination elicits an immune response. First, an innate immune response, and then an adaptive immune response and the production of antibodies. Vaccination does this without a disease occurring. Now, the kinds of antibodies that are produced from a single dose of a vaccine are often not sufficiently protective. In other words, you will get antibodies produced, but those antibodies will decline, and the memory that's produced is usually not sufficient to last a long period of time. So we have learned through trial and error about the importance of boostering vaccines. Now, all that term boostering means is giving more than one exposure to a vaccine. Usually when you're vaccinated, you'll get your first dose, and then in a number of weeks, you'll get a second dose. Some vaccines require even a third or a fourth dose in order to stimulate the kind of lasting protection that we want in each person. For many vaccines, after the original series of shots is completed over a number of weeks, the patient has to return after a number of years and get boosted once again. So, for example, for many of our infant vaccines, the original series of vaccines takes place in the first year of life, but then the child will have to return at the age of, say, 5 for boostering. They'll have to come back again, typically at the age of 15 for boostering, because we're trying to set up the best long-term protection that we can for that person. Lasting immunity, therefore, requires repeated vaccination, or what we call boosters. When you booster a vaccine this way, and again, the schedule for boosters varies from vaccine to vaccine, you're doing a couple of things. You're going to get more antibodies produced with boosters. The antibodies that get produced are better at what they do. In other words, they are better able to find and stick to the antigen and cause it to be destroyed. And the memory of that particular pathogen is improved. So the body will recognize it and start making antibodies more quickly the next time the person gets exposed to it. Now, the last thing I want to talk about today is some of the adverse reactions that we see to vaccines. Adverse reactions to vaccination is actually not uncommon, but most adverse reactions are not serious. So we talk about categories of reactions to vaccines. There are what we call the common adverse reactions. There are what's called the less common adverse reactions. And then there are the rare and severe reactions. Now, some of you have probably experienced a common reaction to a vaccine. It happens in about 1 out of 4 children when we vaccinate them. And these are things like fever, redness at the site of injection, a little bit of swelling, some discomfort. This is a common reaction. And this reaction occurs because the vaccine is doing exactly what we want it to do, which is stimulate the immune system. So that little bit of fever that a child develops in the day or two after vaccination, the redness around the site, a little bit of swelling and some pain on the site, this is good. This actually shows us that the immune system is recognizing the vaccine and reacting to it. Now, there are less common adverse reactions that are a little more concerning, and that in particular refers to the high fever that we see in some children and sometimes seizure that accompanies that high fever. This less common type of vaccine reaction occurs in about 1 out of 15,000 children who are vaccinated. So while it's common for a child to develop a low fever in the area of 100 to 102, less commonly a child will develop fever above 102, and in some children, high fever creates seizure. The rare and severe types of adverse reactions that occur from vaccination occur in about 1 out of 1,000,000 children, and these are severe. Some children actually develop an anaphylactic reaction to a vaccine. And if you're not familiar with that term, anaphylaxis is a type of immune reaction that leads to the closure of the airways and an inability to breathe, and even cardiac arrest and death if it's not treated. This is the most severe type of an allergic reaction that a person can have. Typically, the severe allergic reaction that occurs with a vaccine is not due to the infectious agent, but to some other ingredient in the vaccine, like the preservative or the adjuvant. The other rare and severe adverse reaction we see with vaccines is when a child develops seizure that cannot be stopped. This is known as Dravet syndrome or Dravet syndrome. Some children after vaccination will develop fever and start to seize, and the seizure then cannot be managed. And of course, if you allow a person, particularly a child, to have an ongoing seizure, you run the risk of permanent neurological damage and even death. So it's important to remember when you think about adverse reactions to vaccines that these reactions are not to the vaccine itself. They're not to the infectious agent itself, but rather the response of the immune system. And as I said earlier, in some ways, these types of adverse reactions are good because it shows us that the immune system is doing what we need it to do, which is recognize and attack the vaccine and then develop antibodies and develop memory against the infectious agent. When the immune system responds to antigen, one of the things that happens is chemicals are released that are called cytokines. And it's these chemicals that are released from immune cells that cause things like fever and redness and swelling and pain and even the malaise, the sort of fatigue that comes along sometimes with being vaccinated. So this is a natural immune reaction. It's just that we triggered that immune reaction with the vaccine. And again, when we see the more severe adverse reactions to vaccines, it's typically not to the infectious agent component of the vaccine, but rather to other products like preservatives and adjuvants. So finally, I want to mention just some summary thoughts about vaccination. It's important that we remember that there are people in the population that can't be vaccinated. Young infants, for example, don't have the ability to mount an immune response to a vaccine, and they need to be protected. A lot of elderly people have come to a point in their life where their immune system just doesn't work as well as it used to. So even if you vaccinate them, they simply cannot mount an effective immune response to the vaccine. There are other people in the community that can't be vaccinated because they are allergic to certain components in a vaccine. So it's important that we think about vaccination not just as protecting an individual, but as contributing to herd immunity and protecting very vulnerable members of the population. Vaccines are not without risk. That is true. But of all the medical advances that we have made over the past 200, 250 years, vaccines rank way up at the top. The risk of vaccines is low. The risk of serious, life-threatening, life-altering adverse reactions to vaccines is about 1 in 1 million people who are vaccinated. In some states, it's been a problem in recent years for people to decline to vaccinate their children before they send them to school. And this puts all of our children and other members of the community at high risk. Again, there are some children in school who cannot be vaccinated for the reasons that I've mentioned. And so it's critically important that any child who can be vaccinated safely is vaccinated. There's a movement now in some states to prevent people from declining vaccines and then sending their children to school. Some states are implementing rules where the only people who can enroll their kids in school and not vaccinate are people who have medical reasons not to vaccinate. Right now, though, there are still a lot of states in our country that allow parents to claim just what's known as a personal exemption, that for whatever reason they don't want to vaccinate their children, so they don't have to. And it's these personal exemptions that we really need to re-examine in order to best protect the public health. We're in the midst of a global pandemic right now, and there's been a lot of talk about a vaccine against the SARS-CoV-2 virus. The good news is that that vaccine is in development. And in fact, clinical trials are underway in multiple countries to develop a safe and effective vaccine. Unfortunately, it takes time to develop a safe and effective vaccine. Under the best of conditions, when nothing goes wrong during the development period, it takes about a year to bring a vaccine from the laboratory to a commercially available product. And if you hit any roadblocks along the way, it can take out as much as 18 months to get a vaccine to market. So we won't have a vaccine in all likelihood until 2021. The other thing we need to remember is that once the vaccine is available commercially, in all likelihood, there will be a controlled rollout of vaccination. And what that means is we're not all going to be allowed to get vaccinated at the same time because there won't be enough for everyone all at the same time. So historically, what's been done is we vaccinate the people who are at the greatest risk of contracting the disease first. We vaccinate our healthcare team first. Doctors and nurses and other support personnel in the hospital are on the front lines of the pandemic and they need protection first. Then we vaccinate the people who are at higher risk of contracting the disease because they have chronic illness or underlying comorbidities. Then we vaccinate, for example, children so that they can go back to school or people who can then go back to work. We do it in a controlled manner. In all likelihood, when a vaccine becomes available to protect us against COVID-19, this vaccine will be put into use as soon as possible in a controlled manner.